of the cheek and extensor aspect of the limbs, with mother having history of bronchial asthma or allergic rhinitis. And if it is a case of old man, then they will mention that the flexural areas are the ones which are involved and the recurrent skin infections are seen. This is because a barrier dysfunction is present and there will be severe abdominal cramps and diarrhea. Then the diagnosis goes in favor of atopic dermatitis. The most characteristic feature of atopic dermatitis is pruritus, and in fact, it is said itch is the disease. And in this condition, itch will be seen before even the rash is seen. This is called, in fact, as itch that rashes. And there is Denny Morgan fold in atopic dermatitis. Most common site of atopic dermatitis in adult is, you must check the antecubital fossa, and it is diagnosed by clinical examination with the help of Hanifin-Rajka criteria. The major criteria includes pruritus, the distribution pattern, chronic relapsing type of dermatitis, and the family history, like as I mentioned in the previous case scenario, or like bronchial asthma present in the mother. And certain other minor criteria are also present. Dry skin or xerosis, Denny Morgan fold, P. alba, Pityriasis alba. Pityriasis alba we have discussed in detail in an other video. I will put the link for the same in the iCard above. You can check that. There will be dermographism. That means we can write over the skin. And ichthyosis vulgaris. That is also a type of dry skin. Serum IgE levels. But it is in a question it was mentioned mica like scales, but mica like scales are present in psoriasis. And what are the treatment options available? Calcineurin inhibitors like tacrolimus, pimecrolimus, cyclosporin. Phototherapy is also used. But remember, retinoids have no role in atopic dermatitis. Next topic, which is very important, is seborrheic dermatitis. Here, the case history they will mention the patient has dandruff. Here, the 3 months old infant with scaly lesions which are erythematous or the nasolabial folds. And 24-year male has eczematous dermatitis involved in the scalp and face with greasy yellow scales. This is characteristic feature of seborrheic dermatitis. Seborrheic dermatitis is frequently seen in Parkinson's disease. If infants develop seborrheic dermatitis, it is called as cradle cap. Pityrosporum ovale has a role in seborrheic dermatitis. Few case scenarios which are in favor of insect bite hypersensitivity have also been asked. This is also called as papular urticaria. A 7-year-old boy presenting with excoriated papules on the forehead and exposed parts with seasonal variation. These are the pointers in favor of insect bite hypersensitivity or papular urticaria. In acute eczema and chronic eczema, histopathology will be different. In acute eczema, there will be spongiosis, whereas in chronic eczema, there will be acanthosis. What is the best treatment modality for acute eczemas? Moist compressors, because there will be a lot of oozing, so moist compressors do help. Characteristic of chronic eczema is lichenification. Okay, coming to airborne contact dermatitis. The most common cause in India, it is Parthenium hysterophorus. This is also called as scourge of India. The drug of choice for acute episodes are oral steroids, and drug of choice for long-term immunosuppressive management of airborne contact dermatitis is azathioprine. But be careful if the question mentions that the patient also has blood pressure and diabetes, which are contraindications for steroid usage, then azathioprine would be the preferred answer. Most common cause of allergic contact dermatitis in Indian females is vegetables, onion and garlic to be in particular. Housewives eczema is due to irritant contact dermatitis to detergents. Atopic eczema, you can see white dermographism. This was a minor criteria, Hanifin Rajka criteria. Least potent topical steroid is hydrocortisone 1%. This is very widely used in conditions which involve the face. Most common precipitant of contact dermatitis worldwide is nickel. Barrier creams protect from occupational dermatitis. Farmers because of parthenium, cement and leather industry workers due to potassium dichromate, textile industry workers because of azodize, hairdressers due to paraphenylene diamine, and rubber contact occupational workers because of thiorum mixture. These are all the reasons for the occupational dermatitis in the particular occupants, the workers. Photosensitization of the skin by fluorochemicals in the perfumes is known as Burley dermatitis. Patch testing is done for allergic contact dermatitis and it is read 3 times, once after 2 days at 48 hours, and it is mentioned that best reading time is 4 days or 96 hours and the next reading time is 7 days. Patch testing is a kind of delayed type of hypersensitivity testing. RAST test is used for diagnosis of allergic dermatitis. Coin-shaped eczema is all other name for nummular eczema. Crazy pavement pattern or dry earth pattern is seen in asteatotic eczema, also known as winter eczema, also known as eczema crackle. Commonly seen in old adults. Formfolix 50% of the patients have atopic history. There will be tapioca or sago grain like lesions on the sides of the finger. It's also called as dyshydrotic eczema. Recurrences are very common in this condition. This is associated with severe itching. Severe episodes are treated with short course of steroids in patients whom there is intractable. We cannot treat it with topical formulations. You remember in the question it was mentioned that fingertips have the lesions, but remember sides of the finger are the ones which are involved with sago, grain or tapioca like lesions. Exfoliative dermatitis, also called as erythroderma, can be due to it could be due to drugs, it could be due to seborrheic dermatitis being generalized, it could be cutaneous lymphoma, it could be pityriasis rubra PRP, it could be psoriasis, lichen planus, eczema. Like these are papillosquamous disorders. So in that way, papillosquamous disorders can also lead to exfoliative dermatitis. Papillosquamous disorders I have dealt with this topic in a separate video. The link for the same I will put it in the iCard above. Remember, P. rosea and systemic lupus erythematosus are not the causes for exfoliative dermatitis. Causes of urticaria are it could be cold, it could be hepatitis C, serum sickness. Dermographism is a type of physical urticaria. Urticarial lesions are best described as evanescent lesions. Darrier sign is seen in urticaria pigmentosa. This has been asked a lot many times as a one-liner question. And one more case scenario which can be given is angioneurotic edema. Giving a history, a man taking peanuts, later on which he develops tongue swelling, lip swelling, neck swelling, associated with stridor, hoarseness of voice. A patient develops presence with history of episodic painful edema of the face larynx. The C1 esterase inhibitor is the one which is likely to be deficient in such patients.